Lots of dead skin in this first patient of Katie's today. My name is Reece Barber, one of the audiologists here at Audiology Associates. Coming up for the second video as well, you've also got a super hard wax from Taylor coming up, which is a really, really good one. So this is Katie's patient here. You can see we've got this very kind of soft, what first appears to be wax, okay? Now when she starts to suction that central section of it here, it's not a wax plug we're looking at. What we're looking at here, and you'll be able to see it in a second, look at the left-hand side of this. You can see a gray material there. So what we've got is a lot of keratin, okay? So basically really hardened up skin. So imagine like a sort of leather. I'll explain why that comes about in a minute, but what you've got is this ring of keratin, and then you've got this soft wax which is sitting right in the middle of it, which is kind of blocking the ear up and making this poor patient feel very, very sort of hard of hearing at the moment. So what Katie's managed to do is start to pull this keratin off the side of the canal wall. So I promised I'd tell you what that was. So when skin cells are newly formed, they're sort of full of water, they're really hydrated, really flexible, and they have a certain amount of keratin inside. And what happens with this particular type of problem is the skin should normally migrate to the outer part of the ear canal with your epithelial migration, just a movement of skin from the deepermost part to the outermost part, carrying everything along with it. And what happens is as it moves along in that process, it starts to dehydrate, so you get less water inside those skin cells. And what happens then is they become a lot harder because the concentration of keratin to water becomes much higher because there's less water in the system, and they become a little bit tougher. And that's what's happened here. Now the reason it forms in this ring around this particular part of the ear is because the deepermost part of the ear is basically surrounded by bone, and the outermost part is surrounded by cartilage. And where those two bump up against one another, you get a slight raise like this, and that's called your isthmus. So as it travels the skin from one side to the other, sometimes you'll get the top layer of skin will just detach, and that's what's happened here, and that's why it's formed this ring. So in this case, it's more of a kind of horseshoe shape, because it's the bottom going up to the two sides. Now, what's happening with this is that keratin then has started to kind of accumulate in that area, and then any bits of wax that are trying to form has got stuck in the middle of this horseshoe shape, and that's what's caused the blockage. So Katie's going to have to really work this skin to try and get this off. Now, the skin doesn't normally want to come away, and that's what you can see here. She's really kind of pulling this with a suction, but you can see it just doesn't want to let go. And that's just the nature of skin. You know, if it wanted to kind of separate from other bits of skin, every time we moved a joint or something like that, your skin would pop open, which is not ideal. So what happens is it wants to hold on to other bits of skin. So in this case, it wants to hold on to the fresher skin at the back and the slightly fresher skin underneath. And that's what's holding everything in place. But Katie's doing a cracking job here trying to pull this away. You can see how much she's having to really work this one side of the skin here to get this off and get it away from the ear canal so we can start to draw this out. So this is the standard size ulnar tube here, and you can see as she's lifting, you can see more of that grey material underneath here, and that's that fresher skin underneath, which is sitting just under that harder surface keratin layer that we've got there. What's starting, you can see it's starting to shear on that right hand side, but look now as you go down to the bottom as she lifts this, you can see it's go all the way down there as well. And this keratin, if it stays in the same position for a long period of time, it starts to build and build and build. And what that can start to do is actually remodel the ear canal, which is what you're going to see in a second. So when Katie does get this plug out, what you'll notice is that the patient almost has a little bit of a dip in the ear canal, a little divot, if you like, in the ear canal. And that's a kind of catch-22 when we talk about keratin, because what happens is as that skin tries to migrate, it goes into the dip and tries to get back out the other side, which tends to slow its progress down. So you end up getting more keratin buildup. More keratin, bigger the dip gets, which produces more keratin, you know, causes more keratin to accumulate in this area, and then the dip gets bigger. So it's this kind of almost like a self-fulfilling prophecy, if you like. So it's just constantly vicious cycle. That's the word I was looking for. So it's constantly replenishing all the time. So you do have to have these cleared out on a regular basis. With keratin, I normally recommend about every 6 months thereabouts. So she's popped a little bit of oil in here, and that really does help sometimes to shift skin along. It does seem to make it a little bit easier to get the skin out, and you can really see that white plug there. That's all the fresher, newer skin that's sitting underneath that surface bit of keratin you could see, and she's going to have to really, really work this. But it looks like it's moving towards the outer part of the ear canal, doesn't it? It looks like it's coming down the canal now. She's nearly there. A little bit more. Oh, she's really kind of wiggling this, really trying to detach from either side. You can sometimes use a set of forceps on these, but sometimes if the skin's too soft, it'll just pull straight through. But this is working its way out really well. But look at that plug. That's basically skin, and that's all skin all wrapped around there. And what you'll do now, she'll just tidy this a little bit up at the outside edge. You'll see that little kind of dip I was talking about in the canal. There we are. You can see it just down there. So that's where all that keratin's been sitting, and it's really important we clear those out so it doesn't cause any further problems. So no ruler shot on that one, guys, but stay tuned for Taylor's super hard wax coming up next. Oh, this wax was tough. You can see the color of it straight away. It's got that kind of first of all, at the bottom of it looks quite matte, and then you've got this slightly kind of shinier piece at the top. So when you look at wax, you normally, first thing you do when you look in there, you're looking to see how much is in there, and then you're checking the color, and then you're looking at the surface texture, and all those things are going to kind of tick through your mind before you choose the first tool you're going to go in with. And what Taylor's done here is gone straight in with some suction, which is definitely the right call for this one. It looked like it was a little bit more brittle at the front end, but what happens when he goes a bit further, and you can see that it really kind of slows the progress of the suction very, very quickly. And the reason for that is patients tend to use olive oil. We ask them to use it before they come along, just for a couple of days. And what that does then, it just helps to soften the surface of the wax, but it will only penetrate in so far. And then what you're left with then is a very, very hard section behind, and that's exactly what Taylor's run into now. So sometimes at this point you might be thinking, okay, suction's really, it's working, but we're not making huge amounts of progress. So you could switch it up at this point and use a manual tool just to try and help this along a little bit. But he's managing okay so far. We're getting bits breaking off, but this is quite a sizable old chunk, this one. He's working his way around the outside edge. Now the difficulty with a very dry wax like this one is if you're lucky, the dry wax isn't dried onto the canal wall. But if it is, then you have to detach it first before you can even entertain the idea of getting that wax out. And that's what Taylor was doing down that bottom corner. He was working his way around the outside edge. And you can see he's almost trying to fold the edges of the plug in here, just to try and fold them like this to help to kind of maneuver this out. It's exactly what I'd expect him to do. You can see pull the sides in and then give the central portion of the wax a little bit of a wiggle, and that's just to test whether he's detached enough from the canal wall to bring this out, which it looks like he has for the front section, but I'm not convinced that back section's free yet. I think what he's done is freed up the front section, and as it's wiggling back and forth, you can kind of see it's not pulling the whole thing forwards, it's just pulling that very, very closest to the camera section out. There you go. Now there was a little bit of movement if you spotted it to the top right. Now if it was me, I'd go straight to the top here and try and kind of fold this down, which is exactly where Taylor's going. He's going straight to the top. But the reason being is you've kind of undercut the wax at the bottom. So what you can do then is you can fold into the gap. And that's what he's trying to do here, is fold this down. But it really does depend on how tough and how hardened up that wax is. There you go, pulling the sides in now. So the same technique he used for the right hand side, he's pulling those sides in just to try and loosen this off the canal wall. Oh, did you see the whole thing just twist a little bit then? That's a really good sign. It means that wax is starting to loosen up a little bit. Not quite there, he's almost, there you go. It's a bit of an awkward one because there's not a lot of room left outside, to the sides of this wax plug. So he's trying to get it into a gap and twist it, but that's going. There you go. So he's managed to turn it, which is good. But now it's going to be a different shape to the canal because obviously it's formed to that one specific shape of the canal. So he's going to have to try and wiggle this a little bit more. Don't forget, guys, if you are enjoying the videos and you're enjoying this wax removal, you can, if you wouldn't mind hitting that like button for me, that'd be absolutely, I really would appreciate it. And if you're not subscribed already, click that subscribe button. You'll get notifications every time we do new videos, and check out the membership options as well. And that way then you get to see even more videos every single week. So he's got it stuck on the outer part of the ear canal. He's trying to pull this forwards. He's giving us a damn good wiggle here. Is he going to, I did wonder whether he was going to go in with a Reiki, because sometimes when they get stuck like this, the suction doesn't quite have enough power to pull it through and he'll drop over the Reiki. But it looks like he might be able to wiggle this out. Just a little bit more of a wiggle going on. that gentle rocking motion. Wow, that's a good plug. You can see that was a chunky old plug. Stay tuned for the ruler shot, guys, is at the end. Eardrum's looking absolutely fantastic, but that main bulk of the plug there is that one to the left-hand side. So we are 1/2 inch, just over 1 centimeter, or maybe closer to 1.5 centimeters, looking at that. Well, guys, thank you so much for sticking to the end of the video. Really do appreciate it. Hope you enjoyed listening to us, or to us, I should say, to me, sorry. Sort of explain that video, that wax removal to you. But as always, guys, take care of yourselves, take care of your ears, and take care of one another, and I'll see you next time. Bye, everybody.